I've spent 23 years of my life caring for people the world has forgotten. My name is Helena. I'm a nurse at a long-term psychiatric institution in the interior of Minas Gerais, and what I've seen within these walls has completely changed what I thought I knew about the human mind, about death, and about what exists on the other side. There are people who have been here since the 1980s, patients no one visits anymore, who spend entire decades staring at the same white walls. And you know what I've learned? That when death approaches, even after 40 years of silence, of medication, of diagnoses that no one remembers anymore, they wake up. They come back. And they see things that I can no longer deny. If you're feeling this way with me right now, stop everything, subscribe to the channel, turn on notifications, and leave a comment below about where you're listening from and what time it is there, because the next story will change everything forever. The first time I really paid attention was with Mr. Waldemar. He was 82 years old, hospitalized since 1987 for paranoid schizophrenia. 36 years inside that room in Corridor C. I was still young, I had about 6 years of experience, and Mr. Waldemar was one of the quietest patients we had. He spent the whole day sitting in his wheelchair, looking out the window, but without really seeing anything. He didn't speak. He didn't react. His medical record had 3 pages just of medications that had been tried over the years. First-generation antipsychotics, second-generation antipsychotics, mood stabilizers, everything. Nothing made him recover. It was a Tuesday in March, I remember because it was my daughter's birthday and I had switched shifts so I could leave earlier. At 6:15 in the morning, I went into his room to change his diaper and give him breakfast. The sun was starting to come in through the window, that kind of golden light that hits the back wall. And when I approached the chair, Mr. Waldemar slowly turned his head and looked directly into my eyes. My goodness, I almost dropped the tray. That man hadn't looked at anyone in years. His eyes were light, you know. A kind of faded blue, but at that moment, wow, they were shining. He opened his mouth and spoke, his voice weak but perfectly clear, "My sister is here." I froze. I quickly checked his file at the health center, and yes, he had a sister, Dalva, who had died in 2003. I ran back to the room. "Mr. Waldemar, are you listening to me?" He nodded slowly. "Where is she?" He pointed to the corner of the room, near the wardrobe. "There. She's wearing a blue dress. The same one she wore to Zay's wedding." I couldn't see anything. But the way he spoke, wow, it wasn't delirium. I've worked with delirium for over 2 decades. Delirium is confusing, it's fragmented, the person jumps from subject to subject, gets agitated. This was different. He was calm. He was happy. I sat on the edge of the bed and asked softly, "What is she saying?" He smiled. It was the first time I'd seen that man smile. "She said everything is ready. That I don't need to be afraid. That she came to get me." I stayed with him for the rest of the shift. I called the doctor, Dr. Renata, who had known his case forever. She ordered tests, checked his vital signs, everything normal. Well, normal within his condition. But his lucidity remained. Mr. Waldemar spent the whole day talking to us, remembering things from his childhood, the farm where he grew up, his parents, his siblings. 36 years of silence, and suddenly he was back. The afternoon nurse, Claudia, called me at 8 o'clock at night crying. "Helena, he died. But he died smiling. Holding the hand of someone we couldn't see." It took me a week to process it. I went looking for explanations. I read about terminal lucidity, that phenomenon that Dr. Alexander Bathiany documents, in which patients with advanced dementia, Alzheimer's, chronic schizophrenia, suddenly become completely lucid hours or days before dying. Science can't quite explain it. How does a brain that was completely disorganized, atrophied, full of medication, suddenly function perfectly again? And it's not just functioning. It's returning with intact memories, with personality, with affection. And worse, with visions that are repeated all over the world. The sister in the blue dress. The light. The feeling that someone came to get her. But I still didn't imagine that this was just the beginning of what I was about to witness. The second story happened about 8 months later, with Mrs. Aparecida. She was 79 years old and had been hospitalized since 1991. Diagnosed with bipolar disorder with severe psychotic episodes. She was difficult. She yelled a lot, sometimes assaulted the staff, and had episodes of confusion almost every week. The medication kept her stable most of the time, but for Mrs. Aparecida, stable meant lying down, apathetic, with no interest in anything. It was a Sunday morning in November, and I was on duty in Corridor B. The nursing technician, Joanna, called me running. "Helena, come see Mrs. Tsida. She's acting strange." "Strange how?" "She's awake." "Really?" When I entered the room, Mrs. Aparecida was sitting on the bed, legs crossed, combing her hair with her hands. She looked at me and said, "Good morning, daughter. Could you get me a clean blouse? My mother is coming to visit me, and I want to look presentable." Her mother had died in 1976. I sat down slowly in the chair beside the bed. "Mrs. Tsida, are you feeling well?" She laughed. "I'm great, I've never felt so good. It's been a long time since I felt like myself, you know? It's like I woke up from a very long and bad dream." I asked Joanna to bring a clean blouse from the closet. I helped Mrs. Aparecida get dressed. She was cooperative, kind, something I had never, ever seen in her. "My mother is over there." She pointed to the door. "She's waiting. But she said I can talk to you for a little while first." Folks, I had read about this after Mr. Waldemar's case. I knew it could happen. But seeing it again, live, was something else entirely. "Do you want me to call someone? A family member?" She shook her head. "I don't have anyone, daughter. My brothers disappeared a long time ago. But everything is fine. I'm going home now." Home. She spoke in that way we speak when we're returning from a long and tiring trip. I stayed with her all morning. She told me about her childhood in the countryside of Goiás, about the June festivals, her first boyfriend, the day her father died and she had her first breakdown. I know I was difficult here. I know I yelled, I hit. But I wasn't myself, you understand? It was the illness. I was trapped inside my own head, seeing everything from afar, unable to control anything. She took my hand. "Thank you for taking care of me anyway." Mrs. Aparecida died 3 days later. In her last hours, she kept looking at the door, smiling, talking quietly to someone we couldn't see. The technician who was with her told me that, before closing her eyes for the last time, Mrs. Tsida had said, "I'm going, Mom. Just wait a little longer." And she did. I started writing everything down. I created a small notebook, one of those hardcover ones, where I recorded every case of terminal lucidity I saw. Date, patient's name, length of stay, diagnosis, what they said, what they saw. In 2 years, I already had 17 cases. 17 people who had spent years or decades completely disconnected from reality and who, suddenly, would return lucid, calm, happy, seeing deceased people, talking about light, peace, going home. Always the same words. Always the same pattern. But what I didn't know yet was that the stories were going to become increasingly impossible to explain. The third story involves 3 patients at the same time. This happened in June 2019, a harsh winter here in southern Minas Gerais. We had a severe flu outbreak at the institution, and 3 patients from Corridor A ended up being admitted to the ward at the same time with pneumonia. They were individual rooms, but with a glass wall that faced the corridor, so we could observe everyone at once. The 3 were long-time patients. Mr. Osvaldo, 87 years old, hospitalized since 1983. Mrs. Nuza, 81 years old, hospitalized since 1995. And Mr. João Batista, 76 years old, hospitalized since 2002. Schizophrenia, all 3. None of them had communicated for years. Mr. Osvaldo was practically catatonic. Mrs. Nuza murmured incoherent words all day long. Mr. João Batista spent all his time wrapped in a sheet, with his back to everyone. It was a Friday night. I was on duty alone with 2 technicians. 10:40 p.m. on the ward clock, I remember because I had just written down Mr. Osvaldo's medication. Suddenly, the 3 of them sat up on the bed. At the same time. All 3 of them. I looked through the glass and froze. They were looking at the same spot in the hallway. Not at us. At a point further down, near the stairwell door. Mariana, the technician, came running. What's happening? I didn't know how to answer. We slowly entered Mr. Osvaldo's room. He was sitting with his hands in his lap, smiling. Smiling, people. They came. His voice was weak, but clear. Who came, Mr. Osvaldo? He pointed to the hallway. My parents. My brother Antonio. They're all there. We ran to Dona Nuza's room. Same thing. She was sitting there, eyes wide, but calm. He's calling me. Who? My husband. He's right there, at the door. With Rosa. I checked later. Rosa was her daughter, who had died at the age of 7, in 1972. In João Batista's room, the scene repeated itself. He was sitting on the edge of the bed, his hands outstretched, as if he were holding someone. Mom, he said. I knew you were coming to get me. Folks, I don't know how to explain what happened that night. The 3 patients, who had never spoken to each other and were in separate rooms, woke up at the same minute, looking at the same place, seeing deceased people. And all 3 died in the same early morning, between 3 and 4 o'clock. One after the other. Mr. Osvaldo at 3:10. Mrs. Nuza at 3:28. Mr. João Batista at 3:52. All at peace. All smiling. Mariana asked to leave early. She was trembling. Helena, I can't take it anymore. What was that? I had no answer. I tried to look it up in the literature. I found case reports of shared death, studied by people like Raymond Moody, in which people close to the dying person also have experiences of seeing the light, of feeling the presence of the deceased. But this was different. These were 3 severely ill psychiatric patients, hospitalized for decades, who suddenly had the same experience, at the same moment, seeing different people, but with the same pattern, deceased relatives who had come to collect them. I slept badly for a whole week. And every time I closed my eyes, I saw that scene, the 3 of them sitting on the bed, looking out into the empty hallway, smiling. But nothing, absolutely nothing, prepared me for what happened to little Isabella. The 4th story is the most painful of all. Isabella was 9 years old. It wasn't common for us to have children at the institution, but her case was special. She was born with a rare genetic syndrome, with severe neurological impairment, and her parents, after years of trying to care for her at home, could no longer manage. Her mother had a nervous breakdown. Her father was unemployed. Social services managed to get her a place here in the pediatric ward, which is separate from the rest of the institution. Isabella didn't speak. She didn't walk. She spent the day lying down, fed through a tube. But she could hear. We knew she could hear because when someone entered the room and spoke to her, she would move her little eyes, following the sound. And sometimes, very occasionally, she would smile. A tiny smile, but one that lit up the whole room. I volunteered to work shifts in the pediatric ward whenever possible because I couldn't bear the thought of that little girl being alone. Her mother visited once a month, always crying, always consumed by guilt. Her father never showed up. Isabella stayed with us for a year and a half. And I swear to God, she was the sweetest child I've ever known. There was something about her, you know? A peace. A light. Even without being able to communicate, she radiated love. In January 2021, Isabella's condition began to worsen. Constant respiratory infections, her little body becoming increasingly fragile. The medical team had already spoken with her mother about palliative care. There was nothing more to be done. It was only a matter of time. It was a Thursday afternoon, bright sunlight streaming through her bedroom window. I was changing her drip when I noticed she was different. Her eyes, wow, they were shining. She was staring intently at the ceiling, but not in her usual vague way. It was a focused gaze. Intense. And she was smiling. Not a small smile. A huge smile. I leaned over her. "Isa, what are you seeing, my love?" She couldn't answer, but she kept smiling, and suddenly she raised her little hand. That little hand that had never moved properly, that was always closed, stiff. She raised it and stretched it upwards, as if she were reaching for someone. And she began to laugh. A soft, weak laugh, but it was a laugh. Pure. Happy. I called the doctor. I called the coordinator. The three of us stood there, around the bed, watching that little girl looking at something we couldn't see, laughing, reaching out her hand. "What is she seeing?" the coordinator whispered. I didn't answer, but I knew. I knew exactly what she was seeing. Isabella died 2 hours later. She died laughing. With her little hand outstretched upwards. And you know what was most incredible? Her mother arrived 15 minutes earlier. The social worker had managed to give her timely notice. And when the mother entered the room and saw her daughter like that, smiling, she didn't panic. She sat beside the bed, took Isabella's other little hand, and whispered, "Go, my daughter. Go with the one who came to get you. Everything is all right." Then, when it was over, her mother hugged me and cried on my shoulder. But it wasn't a cry of despair. It was a cry of relief. She saw someone, didn't she? I nodded. She was happy. I nodded again, crying along with her. Then I know she's okay. I know someone was waiting for her on the other side. People, I can't talk about this story without crying even today. But I need to talk about it, because people need to know. Children also see it. Children are also sought after. And death, for them, isn't scary. It's a reunion. But if I thought nothing could shock me more than that, I was completely wrong. The fifth story happened in September 2022, and I guarantee, even the doctors who are skeptical, who don't believe in any of this, were left speechless. The patient was Mr. Mario, 84 years old, hospitalized since 2005. He had suffered a severe stroke, was left with serious neurological sequelae, and developed vascular dementia. He didn't speak. He didn't recognize anyone. He was bedridden, dependent on everything. One Saturday morning, I arrived for my shift and the night nurse, Paula, was in shock. "Helena, you need to see this." Mr. Mario was sitting on the bed. Alone. He, who hadn't moved without help for 17 years, was sitting with his back straight, looking out the window. "Mr. Mario?" He turned his head slowly and looked at me. His eyes were clear, lucid, and he said, "Good morning, young lady. What a beautiful day, isn't it?" Oh my God, I almost fainted. Paula had already notified the doctor, who was on her way. But I approached slowly and asked, "Are you feeling all right? Do you need anything?" He smiled. "I'm great. It's been a long time since I felt this good. I'm just waiting for my wife. She said she's coming to pick me up today." His wife, Donna Irene, had died in 1998. But that wasn't the most shocking thing. What happened next was the most shocking thing. Dr. Christina arrived, examined him, ordered a CT scan, blood tests, everything. And when the CT scan results came back, she turned white. She called us in to see it. The image showed that Mr. Mario's brain was extremely atrophied. Large areas of necrosis. Technically, according to Dr. Christina, he shouldn't have been conscious. He shouldn't have been talking. He shouldn't have been moving. But he was. He spent the whole day talking to us. Remembering everything. His childhood in the countryside, his marriage to Donna Irene, his children whom he hadn't seen for over a decade. He asked to call his eldest son. We called. His son didn't answer. SCU Mario was sad for a moment, but then said, "That's all right. He has his own life. I just wanted to say that I love him and that everything is forgiven." In the late afternoon, he became quieter. He lay down again, but remained lucid. And he began to talk to someone we couldn't see. "Irene, my love, I'm ready. You can take me." He extended his hand to the side, as if he were holding someone's hand. I know. It will be beautiful." And he smiled. Oh my, how he smiled. Mr. Mario died at 6:32 p.m. He fell asleep. He simply fell asleep. And that was it. Dr. Christina called me into the hallway afterward. She was trembling. "Helena, I can't explain this. His brain was destroyed. He shouldn't have been conscious. And he was. Perfectly conscious. This makes absolutely no sense within what I've learned in 30 years of medicine." I held her hand. "I know. But it happened. And it's not the first time." After that day, Dr. Christina began paying attention to the cases of terminal lucidity at the institution. She started reading the studies I had found, about the work of Bruce Grayson, Pim van Lommel, and Sam Parnia. And she told me something I will never forget. "Helena, I've spent my whole life thinking that consciousness comes from the brain. That when the brain dies, it's over. But what if I'm wrong? What if consciousness isn't produced by the brain, but only filtered by it? And when the filter breaks, at the moment of death, consciousness expands?" I didn't have an answer. But that question kept echoing in my head for months. And then came the story that made me rethink everything I thought I knew about coincidence and reality. The sixth story happened last year, in March 2024, and was witnessed by 7 people at the same time. 7. Including the doctor, 2 nurses, 3 nursing technicians, and the social worker. We even joked today that it was the best documented story in the institution, because everyone saw it, and no one can deny what happened. The patient was Mr. Sebastio, 91 years old, hospitalized since 1988. Diagnosed with schizophrenia with recurrent psychotic episodes. He was complicated. Aggressive, distrustful, he hadn't communicated coherently for at least 20 years. He lived in his own inaccessible world. Medication controlled the crises, but he never truly improved. In March, Mr. Sebastio had a severe case of pneumonia. He was taken to the ward, and we knew he wasn't going to make it. He was very weak. The staff were already providing comfort care. It was a Tuesday, around 3 o'clock. I was in the ward with the technician Fernanda, changing his 4 fluids. Dr. Christina was reviewing medical records in the small room next door. The social worker, Mrs. Vera, had come for a routine visit. Suddenly, Mr. Sebastio opened his eyes. He turned his head slowly and looked directly at the door. And he spoke, in a strong, clear voice, something I had never, ever heard from him. "They've arrived." Fernanda put the tray down on the small table. I turned around. "Who arrived, Mr. Sebastio?" He pointed to the infirmary door, which was open. "My family. They're all there. My father, my mother, my brothers. Even Tonico." Tonico was his childhood dog, we found out later. Dr. Christina heard and came running. Mrs. Vera followed right behind her. 2 more technicians who were in the hallway, Jessica and Roberta, also came in. And what happened next, folks? I don't even know how to describe it. Mr. Sebastio sat up in bed. Alone. He, who was practically in a coma, who didn't even have the strength to hold a spoon, got up, sat on the edge of the bed, and smiled. And it wasn't just any smile. It was the smile of someone seeing loved ones again after many, many years. He started talking to them. "Dad, are you all right? Mom too? Oh, I missed you so much. I missed you so much. And then he stretched both arms forward, as if he were embracing someone. And at that moment, I swear to God, I swear on my daughter's life, we all felt it. It wasn't imagination. It was real. The room's temperature changed. It became warm. A pleasant, enveloping warmth. And there was a smell. A sweet, floral smell that wasn't there before and that disappeared soon after. Jessica started crying immediately. Roberta knelt down. Donna Vera put her hand to her chest and whispered, "My God." SCU Sebastio remained there, arms outstretched, talking to people we couldn't see, but whom he could clearly see. "I'll go with you. I'm ready." "Yes, I'm ready." And suddenly he looked at us, at all of us who were in the room, and said, "Thank you for everything. You took care of me when no one else did. I'll be all right now. I'm going home." He lay down again, closed his eyes, and died. Right there. In that instant. The silence that fell over the room was indescribable. We looked at each other, not knowing what to say. Dr. Christina was pale. Fernando was trembling. I was crying. And Donna Vera, who has been a spiritualist for 40 years, was the first to speak. He was taken away. The whole family came to get him. Later, we gathered in the break room to talk about what had happened. And everyone, without exception, confirmed that they had felt the change in temperature. And the smell. That inexplicable smell. Dr. Christina tried to rationalize it. It could have been a collective hallucination, it could have been suggestion. But her voice was faltering. She didn't believe what she was saying. Jessica, who has always been super skeptical, said crying, "Guys, I don't believe in these things. I never have. But I felt it. I felt something in that room. And it wasn't my imagination." That case changed the entire team. It changed the way we look at death. It changed the way we treat patients in their final days. Because we truly understood that they are not alone. That there is someone waiting. There always is. But after all of that, after all those stories I saw, that I witnessed, that I wrote down, I still couldn't imagine that the most powerful one of all would happen to me. The seventh story is mine. And I'm going to tell you exactly how it was, because I need to. I need you to know that I don't believe in these things anymore. I know. I know because I lived it. It was October of last year, 2024. My mother, Donna Lourdes, was hospitalized at home, with terminal pancreatic cancer. She was 78 years old. We knew it was a matter of days. I had taken leave from work to stay with her. My brother João came to help when he could, but most of the time it was just me, her, and the nursing technician we had hired to care for her. My mother was lucid. Conscious. She talked to me, asked me for water, complained of pain. She didn't have dementia, she wasn't confused. She was there, completely fine. But on October 15th, a Wednesday, at 5:30 in the afternoon, something changed. I was sitting in the chair next to her bed, holding her hand. Her eyes were closed, she was breathing slowly. Suddenly, she opened her eyes and smiled. That wide, beautiful smile I hadn't seen in months. "Daughter, your father is here." My father had died in 2016. "Mom, what do you see?" She pointed to the foot of the bed. "He's right there. In a blue suit. The same one he wore on our wedding anniversary." Folks, I recognized that suit. I had a picture of him in that suit. And my mother wasn't confused. She knew where she was, she knew who I was, she knew my father had died. But she was seeing him. "He's smiling at me," she said. "He's saying it's time. That he's come to get me." I started to cry. I didn't want her to go. I knew she was suffering, that there was no hope left, but I didn't want her to. She squeezed my hand. "Daughter, don't cry. Everything is all right. I'm seeing, oh my, I'm seeing so many beautiful things." She looked up. there's a light. A warm, golden light that's calling me. And I'm not afraid. I'm not afraid at all. I stood there, holding her hand, while she described everything. She said my father was reaching out to her. That my grandmother, who had died when I was a child, was also there. That there were more people she didn't know, but who radiated peace. Everyone is smiling, daughter. It's beautiful. It's so beautiful. She looked at me again, her eyes shining. You're going to be okay. You're strong. And when your time comes, we'll be waiting for you too. And then something happened that I still can't explain to this day. My mother pulled me closer and said, "Look, Helena. Look where I'm looking." I looked. And wow. I saw it. I don't know if it was suggestion, emotion, or exhaustion, but I swear I saw it. There was a light at the foot of the bed. A warm, golden light that didn't come from anywhere. And within that light, I saw my father's silhouette. I saw it. Not clearly, not like seeing a real person, but I saw it. And I felt it. I felt a presence. I felt peace. I felt love. I felt that everything was all right. I broke down. I fell to my knees beside the bed, crying, holding my mother's hand, and she ran her hand through my hair, like she used to when I was a child. "It's okay, daughter. It's all right. Death isn't the end. It's just the passage. And on the other side it's beautiful." My mother died 3 hours later, at 8:15 p.m. She died holding my hand, with that smile on her face. And when she breathed her last, I felt it again. I felt that warmth. That sweet smell. And I felt that she wasn't alone. That my father had truly come to get her. I know many people will say it was a hallucination. That it was my brain trying to comfort me in a moment of pain. That it was an illusion. But folks, I've been working with this for over 20 years. I know how to distinguish delusion from reality. I know how to distinguish suggestion from real experience. And that was real. As real as me being here now, talking to you. After my mother died, I returned to the institution. And I changed. I'm no longer afraid of death. I no longer see death as something horrible, as a tragic end. I see death as a passage. As a reunion. As a return home. And do you know what I learned from all this? From Mr. Waldemar, from Mrs. Aparecida, from little Isabella, from Mr. Mario, from Mr. Sebastio, and from my own mother? I learned that we are not alone. We never are. That when our time comes, there will be someone waiting. Someone we love. Someone who has gone before. And they will extend their hand, and we will go with them, and it will be beautiful. I know that many people are afraid of dying. I was. I was very afraid. But now I'm not anymore. Because I saw it. I saw it with my own eyes, dozens of times, that death is not darkness. It is not loneliness. It is not the end. Death is light. It is love. It is peace. It is reunion. And if you're listening to me now and you're afraid of your own death, or the death of someone you love, I want you to know, it's okay. Everything will be okay. Because on the other side, they're waiting. With open arms. Smiling. And saying, "Welcome back home." I don't believe in that stuff anymore. I know. And now you know it too.